Hi, I'm Allison Stratton, and I'm going to be discussing how to check pulse and respirations. As I am a nurse in an emergency room department, and it is very important that we check pulse and respirations. There are multiple ways that we can do that, which I will go further into once I get into my presentation. But it's just a basic knowledge that as a nurse we need to know. I work in the emergency room department, and every patient that comes in, they need to have their pulse checked when they get there, and every half hour at least while they're there, and then prior to them leaving, as well as respirations. There are multiple ways, like I said before, of how to check a pulse, and I will just go over a couple that will maybe be helpful to you as an individual that's not in the medical field. So first off, I'm going to go over how to check a carotid pulse. That is on either side of the neck. You're going to feel down about by the ear and below your jawbone, and you can feel your pulse going bump, bump, bump. Mine's going a little fast now, just since I'm a little nervous in front of the camera, and it's on the exact same side on the other side. You don't want to feel with your thumb. Usually you feel with your first two fingers, so on either side. And you can count for 15 seconds and times that by 4, which will give you your heartbeat per minute. It's important that your heart rate while you're sitting or at rest is between 60 and 100 beats per minute. Everybody's different. It'll kind of depend on medical history and that sort of thing and medications that you're on. But for the most part, most people run between 60 and 100 beats per minute. If you don't want to check for 15 seconds and want to check a little longer, you check for 30 seconds and just times it by 2, or you can count the full minute out. You do want your pulse to be very regular and strong, a strong beat. If it's irregular, I would suggest that you maybe go in and have a checkup with your doctor. So second off, I'm going to check or let you know how to check a radial pulse, and that's down by your wrist. That's by your radial bone. It's on your thumb side and on the inner aspect of your wrist here. And you can feel that bump, bump, bump again. It's on the same thing on the other side. Again, feel with 2 fingers because your pulse, you can feel that in your thumb, so you might miss a beat or count an extra beat if you're using your thumb. So go ahead and just count again 15 seconds, times that by 4. If you count for 30, you just times it by 2. And actually, if you check them at the same time, if you check your carotid and your radial, they should be beating at the same time, since it is an artery and it's coming from your heart. And you can do this on any individual. You can check your brother, your sister, your coworker, neighbor, mom or dad. So now you know how to check a pulse, and like I said, that's only 2 ways of checking a pulse. And now I'm going to go into counting respirations. When you count respirations, you can feel on somebody's chest or feel on somebody's abdomen down low. And again, you just count for the 15 seconds, times it by 4, count for 30 seconds, times it by 2. Your respirations at rest should be between 12 and 20 respirations per minute. So now you know a little bit of what I do as a nurse and what's very important. So check the pulse and check respirations. Thanks.